So what do we mean by reflux disease or gastroesophageal reflux disease? Basically what's happening is the acid in your stomach is coming up into your esophagus, which is your food pipe, and causes symptoms. You can have the classic heartburn symptoms, which is called classic GERD or gastroesophageal reflux disease. You have the extraesophageal or atypical GERD. That means when the acid goes in other places than just the esophagus, it can cause further problems. And you have something called complicated GERD. So you have the substernal burning. It's aggravated by change in position. And if you take antacids, you have relief of symptoms. Now when we talk about the extraesophageal symptoms, that means what else can happen due to reflux disease or GERD. As far as the lung is concerned, you can have asthma, aspiration pneumonia, chronic bronchitis, and something called pulmonary fibrosis. From the ENT perspective, you have hoarseness, laryngitis, pharyngitis, chronic cough, etc. And this is what happens when you have a bad case of reflux disease. The acid goes up into the esophagus and then goes into your vocal cords and then into your lungs. There are some diagnostic tests that we do to diagnose this condition. And these include a barium swallow. Endoscopy, you all are very familiar with endoscopy. Ambulatory pH monitoring. If you remember your chemistry 101, it's basically checking how much acid or alkaline is the media in your esophagus. So what we do is we put a little probe in there into the esophagus and we monitor it for about 24 hours, 48 hours. This is the newer technology I was talking about, which is the wireless capsule that we attach to the esophagus, and now we can record actually for 48 hours rather than just 24 hours. Let's move on to treatment. The goals of treatment are to eliminate symptoms, and if you have something called esophagitis, we want that to heal. We want to manage or prevent complication and maintain remission. Treatment-wise, perhaps the first medication that was made, and this was a group of medications called H2 blockers. The H2 blockers that first came out in the market are the Tagamet, Zantac, Pepcid, Axid. You're familiar with that. Complications, of course, you'll have ulcers in your esophagus. You can have strictures or narrowing in your esophagus. You have something called Barrett's esophagus, and of course the risk of carcinoma. Some of the surgical therapies that we do, which you can also have for reflux disease, is something called a Nissen fundoplication, where we wrap the stomach around the lower end of your esophagus, and basically you're restoring the normal anatomy and the normal sphincter at the junction of the esophagus and stomach and preventing the acid from coming back up.